Welcome to the video training program of InTouch EMR, the fast, simple, and integrated EMR that adapts to you. We're excited to show you everything InTouch EMR can do to streamline your practice. So let's get started.
Hi everybody, this is Nitin Choda, CEO of InTouchEMR.com and InTouchBillerPro.com. Now we've all heard the saying that prevention is better than cure. So what Obamacare is trying to do is to increase patients' responsibility to focus more on prevention and therefore reducing the cost, reducing the aggravation, reducing all the problems, the billions of dollars in healthcare costs associated with the cure. Now obviously this is easier said than done because there's a genetic component to elements like diabetes, heart disease, things like that. I personally have a family history of diabetes and heart disease. There's always a genetic component and people are predisposed to things like that. In addition to that, getting healthier, how does an individual get healthier? They make better decisions, they should exercise, they should buy healthier food and have the financial means and the access and the education to buy healthier food, to exercise, and to focus more on prevention. So here's how Obamacare, the Affordable Health Care Act, is trying to tackle this rather complex issue. On the one hand, when it comes to the cure and when it comes to healthcare, Obamacare, through the healthcare insurance exchanges, is attempting to provide insurance, affordable insurance to all Americans. It's done through the expansion of Medicaid on one hand for individuals who are close to the poverty line and the availability of affordable health care through the healthcare insurance exchanges. So, and in fact, patients who have no insurance are going to actually be paying penalties, the IMT or the individual mandate tax, which is going to increase every year subsequently from 2014 to 2015 to 2016. So that's a new reality. But there's a little known initiative from the federal government which is a part of Obamacare, and that initiative is called the National Prevention, Health Promotion and Public Health Council. So once again, it's a national prevention, health promotion and the Public Health Council. Through this initiative, the goal is to help individuals get low cost or no cost access to preventive services. So for example, Obamacare includes specific provisions to help achieve the goal of prevention. Under the Act, individuals have no co-pays when they're looking for preventive services like immunizations, like vaccines, like cancer screenings, medications to stop smoking. There'll be no co-pays for things like that focus more on prevention. The whole objective of the council is to help the federal government reduce costs by helping consumers focus more on prevention. The organization will study the impact of all these preventive measures and prepare a comprehensive list of recommendations on how the overall health of Americans can be improved to reduce healthcare costs in the future. Now, other services that are included as part of prevention include screening for depression. They include screening for high blood pressure and diabetes, along with screening for HIV, sexually transmitted diseases, and even birth control. So the full list has not yet been finalized, but the goal is to induce more people to undergo preventive treatment in order to reduce the more expensive costs of actual prevention, like I said, being better than cure. The strategy is to avoid costly treatments later on. Now, all of these things will actually go into effect very shortly with Obamacare coming up. But for you as a clinician, you need to understand that preventive services and educating your patients about preventive services is where you should be spending more of your time and energy, and knowing the overall emphasis of Obamacare in essentially inducing patients to accept more responsibility is a direction that you should go in as well. Try and offer more preventive services to your patients. Like I've said earlier, let's be a part of the solution and not just a part of the problem. Thank you so much for watching, and I hope this video was beneficial.
Thanks for watching this video training from InTouch EMR, the fast, simple, and integrated EMR that adapts to you. We'll see you in the next training module.